Let's talk about gastritis. What does itis mean? What does gast mean? So what is gastritis? Oh no, that's terrible. What happened to them? Lots of things, like what? Maybe. Could it be infection? Or they just keep eating or drinking or smoking things that they should not eat, drink, or smoke? Yes? Give me your gastric irritants. What are known gastric irritants? Caffeine, alcohol, spicy foods. I mean, smoking, NSAIDs. Oh, mint, peppermint, peppermint. Yes, I think I said meat. I was like, what the? But now I understand. So she's not stupid. Oh, that's a great thing to say. Yes. Okay. So peppermint can decrease nausea in patients that have an intact stomach. So like if you're pregnant or like you're feeling sick or something, peppermint has a little menthols that will help. But think of what happens if you have a super irritated stomach and then you stick an Altoid on it. It'll burn. Okay. So peppermint is good for nausea. Peppermint is not good if you have like hamburger meat for your stomach lining. Okay. Oh, that's gross the way I said that. Sorry, I'm gross. All right, so there's, keep going on gastric irritants. You need to know them all. Chocolate, citrus, tomatoes, which is actually considered a citrus. Spicy, high-fat foods, fried foods. Yes, y'all are feeling this. Okay, all right. So there's two different types of gastritis. We're going to talk about acute and chronic. Acute happen usually, I mean, it could be you got a stomach bug, right? Yeah, you ate some raw chicken or you ate some Taco Bell, okay? And that could be Salmonella, Shigella, something like that, or something that's just irritating to the stomach lining, right? Now, why are NSAIDs notorious for irritating the lining of the stomach? No. Aspirin is called, what's the actual name for aspirin? That's Tylenol. Huh? Why does everybody keep going? Okay, salicylic acid is your actual name of aspirin. It's a acid. Now, what is the MOA of aspirin? How does it work? It does decrease prostaglandins. So how does it do that? It's a COX blocker. Oh, what were you talking about? Okay, so it's a COX blocker. It's called COX-1. Good COX. COX-2, bad COX. Okay, you only supposed to have one at a time. So what COX does, the COX system in your body, okay, COX-2 helps, that produces prostaglandins. What's your keyword for prostaglandins? Pain producers, right? So they increase fever and they increase inflammation and they bring a bunch of inflammatory, right? That's intense. COX-1 is the good COX, right? It increases the mucus in your stomach. It decreases the acid. Okay. It helps to make bicarb. What do y'all know about bicarb? It's a base, so that's good. It's very stomach protective. But aspirin is a generic like COX blocker. Okay. So it blocks COX-2, which is what helps to decrease pain, inflammation, and fever. That's what we use aspirin for. But it also blocks COX-1, which was the good COX. So it makes more acid in the stomach. It makes less mucus. It makes less bicarb. Do you understand? Okay. So that's how aspirin will tear up your stomach. And all NSAIDs work that way. They are non-selective COX blockers. Do we understand? All right. So that's why NSAIDs, if you take them on an empty stomach, RIP your stomach. You're always supposed to take NSAIDs with food. You will be tested on that in nursing school in so many different ways in so many different classes. Do you understand me? All right. Next is corticosteroids. What are corticosteroids? Decrease inflammation. Okay, they are anti-inflammatories, and that's not like a real drug class. Like, what do they do? Besides decrease inflammation? Okay, but all right. So how do they decrease inflammation? By bringing the fluid back to the vessel. Okay, what are corticosteroids? Cortico. It is synthetic cortisol. Hello. What is cortisol's job? It is a stress response, right? And what does a stress response do? Well, that is one of the functions, yes. But what's the overall function of the stress response? What's it supposed to do? It tells your immune system, settle down. So when you give corticosteroids, what is it doing? It's telling your immune system, settle down, right? It is synthetic cortisol and aldosterone. You with me? Okay. Now, one of cortisol's functions, Lexi told us, is make more acid. So when you're taking corticosteroids, it is making more stomach acid. That's why corticosteroids will tear up your stomach. Do you understand? Yeah. You have to take them with food. Like have you ever gotten like a prednisone pack or something, like a steroid pack? Oh, yeah. It will say huge on it, take with food, or again, RIP your stomach. Do you understand? Mm-hmm. All right. Alcohol, known gastric irritant. Yes. Predominant bacteria in the stomach. H. pylori can wreak havoc on your stomach. Any gastric irritants. Hispanic and African American race have a much higher risk of acute gastritis. Bacterial infections. Like what? You ate something that had some kind of nasty something in it. Now, Salmonella Shigella may cause you to have a stomach. But remember, Salmonella and Shigella will usually cause bloody stool. They usually wreak havoc on the gut, but it is a possibility too. Do you understand the causes of acute gastritis? All right, so if your stomach lining is bright red, super inflamed, what kind of symptoms will that produce? Nausea, vomiting for sure. Heartburn, which is also called pyrosis. It's going to hurt like a holy hell. Okay, y'all should have done the quadrants in the prep work, yes? Okay, so what would you call stomach pain? Okay, don't worry about the quadrants. What do you call stomach? If you literally have pain in the stomach, epigastric, because gastric means stomach. So if you actually have stomach, and that's right up here in your chest, right? Because your stomach starts right here. Yes? Okay. So it'd be epigastric pain. They may have a low-grade fever, right? Because it's really inflamed. Yes? And it burns when? All the time. Now, what is very important in this module is to know the describing words of the pain. They're very, very big on this. Okay, that's for everybody in this room, no matter what you're doing, NCLEX prep, whatever. When we're doing GI, they are very big on when the pain is happening, what makes it better, what makes it worse, and then look at the describing words I use. Like if I say burning, gnawing pain, they're going to use that. And each one has a different type of pain. Do you understand what I'm saying? So you can't just learn pain for each of these. You have to know the adjectives, okay? It's going to burn all the time because it is chronically inflamed, okay? All right, so how would we diagnose acute gastritis? Well, I can be like, oh, your stomach hurts. Oh, you ate Taco Bell. Yeah, girl, you got some gastritis, okay? But if I'm not sure and they maybe you've had some risk factors, like maybe you take aspirin every day or something, and I'm not sure if it's peptic ulcer disease or gastritis, I'm going to scope you, right? And what's that called? Endoscopy. Okay, do not call it an endoscopy. Okay, how do we treat it? The big three. Number one, PPIs, which end in prozol. Number two, H2RAs, which end in tadine. And number three, antacids. When do you take antacids? After meals. After meals. Why do we take it after meals? Because if you take it before meals, which 99% of the population does, right? They're like, oh yeah, I'm about to just really go crazy on this pizza. Like, and then they just pop a bunch of antacids and then eat the pizza. Well, what did you just do? You decreased all of your acid. Now I can't break down my food or break down any of the bacteria that's in that food. So when do you take antacids? After our meals. You with? Okay. Nursing care. So if the patient isn't, what's wrong? Yes, they're antagonists. So H2 receptor antagonist. What does an antagonist mean? If I'm antagonizing you, I'm against you, right? So I'm going to do the opposite. So we'll cut out your history. All right, so nursing care. Am I going to let this patient eat if their stomach is bright red and painful? Probably not. If they can tolerate foods, so I'll let them eat just a bland diet is fine, right? Avoiding all of our gastric irritants. Now, I'm going to call that the GERD diet from here on out, okay? Because it was started out as a GERD diet. Y'all understand they don't have GERD, okay? But y'all know what I mean by the GERD diet. No smoking, no alcohol, citrus, spicy foods, high fat. You got it, okay. All right, you need to treat the underlying cause. Look at me, not your paper. How do you treat H. pylori? 2 antibiotics plus a PPI for, okay, cool. If they're in the hospital for this, they're going to be in a lot of pain, so I should give them some analgesics, right? They're probably going to need some IV fluids, especially if I make them NPO. They probably don't need an NG tube because I'm not anticipating putting this patient NPO for a long period of time. Acute gastritis only lasts a couple of days. Yeah, I've all had a stomach bug before. 24 hours, 48 hours, you're done. Okay. All right, but let's talk about chronic gastritis. So who do you think has this? Don't look at your papers. Alcoholics, big one. What else? Major, but they'd have to be pretty heavy smokers to get a chronic gastritis, but fair enough. Like really irritating diets that they don't stop, that's a possibility. If they have H. pylori, that's another big one. Or if they have any type of autoimmune disease, because what does an autoimmune disease do? It attacks you, right? And so there are some that will attack the stomach. Now, anytime you have chronic inflammation of cells, what are you at risk for? Cancer. Because chronic inflammation changes your cells over time. Yeah? So patients with chronic gastritis would be at risk of gastric cancer. So we probably ought to fix it. If they have a history of radiation, so let's say they had a gastric tumor already and they had radiation to that area. What is radiation as a cancer treatment? What does it do? Y'all have heard of it. Okay, well, what does it do? Huh? Well, it will shrink it, but how? How does it kill the cells? It's like, y'all know what a lightsaber is? It's a lightsaber, okay? And yes, it is very tiny and it will burn, but once you start burning, it is such a hot fire burn, it will burn everything around it, okay? So let's say your tumor is this big, okay? They can do a targeted radiation just to that spot, but it's going to burn like this. Y'all ever gotten a burn before? It looks fine day one, and then day two, you're like, oh, shit, right? Because it's going to burn all the way around it. And what happens when I burn cells? What happens when you get a sunburn? Aren't you more at risk of cancer? Anytime you burn your cells, they're going to come back not the same as they were before. So if a patient had radiation anywhere near their stomach, they're going to be at high risk of chronic gastritis, especially since radiation is recurrent. Okay. It's fine. She's just a child. Everything's all right. All right. So signs and symptoms. Where does this hurt? Epigastric pain. Okay. Now, do you think they're going to want to eat much? And this is chronic. So what's going to happen? Weight loss, right? What's the best indicator of malnutrition? Daily weights is fluid balance. Albumin levels. That is on your nutrition ETI. FYI. Albumin and pre-albumin. Because what is albumin? It's a protein, and what's its job? Now go closer. It keeps fluid in the vessel. What's a normal? Thank you. What's a normal albumin level? Stop it. Stop it. Albumin. 3.5 to 4.5. Do we need another quiz? Okay. All right. All right. Okay. They may have nausea and vomiting like a lot. Well, that's a problem. That can create. If they have lots of nausea and vomiting, what are our two risks? Oh, maybe, huh? Dehydration's a big one, and electrolyte disturbances. What's a predominant electrolyte in your stomach? Potassium. So what electrolyte imbalance might they go into? Hypokalemia. What acid-base imbalance might they go into? Metabolic alkalosis, because you're getting rid of all your acid from your stomach. You with me? All right. Chronic gastritis. You remember the GI man? I've done that for everybody, right? Did you do that? Did I do that? Okay, okay. All right. So it is going to be a little bit more mild, but it is going to be constant and all the time because it's gastritis chronic. Yes? All right. How do I know they have it? I want to see it. I just told you not to call it that. Endoscopy. All right. If you say it in a British accent, it'll help you say it correctly. Endoscopy. Okay. All right. You will see increased ESR and CRP. What do those tell me? ESR and CRP are markers of inflammation. They're blood tests that we do that tell us you have inflammation somewhere. What do you think the treatment is? Give me the big three. Number one, antacids. Number two, sorry, H2RAs, which end in tidine, and PPIs, which end in prazole. Y'all with me? Okay. Then probably some antiemetics like ondansetron, promethazine, and metoclopramide. Okay. And then maybe some analgesics, but you got to be careful with those. You want to give this dude NSAIDs? Okay, so that's a no. So what would you give them? Tylenol, so we can just ruin the liver along with it. All right, all right. Nursing care, they're going to go on the, quote, GERD diet. Do you understand what I mean by that? Does this patient have GERD? No, but do you understand what I mean by it's in quotes? Okay, you got this. Remove the offending agent. So maybe the first thing you should say is stop drinking, stop smoking, stop it. If they're on aspirin, we can change them to enteric-coated. What is enteric-coated aspirin? So it has a coating around it that will not break down in the stomach. It will go down into the small intestine there where it breaks down. So it'll avoid your stomach. You with? Okay, we're going to do a daily weight so I can see if they're losing weight. Okay, and we need to manage the pain somehow. You got to figure that out. I obviously don't want to give this patient opioids long term. We never do that, right? How come? Addiction, tolerance, long term consequences of opioids. Hello. Long term consequences of opioids. They're not toxic to any organs. Constipation, severe constipation. Osteoporosis is another very big one. Okay, so we don't ever want to give somebody chronic opioids, too many problems, right? And the number one thing you're going to tell them is lay off the booze. Okay, do we understand acute and chronic gastritis?